Hi guys, welcome back to Dr. AI YouTube channel. In this video, we are going to talk about the lower end of humerus. Here we are going to discuss the parts and the attachments and the features of each part in this lower end of humerus. There are two diagrams according to the anterior view and posterior view. And in the lower end of humerus, it can be divided into two categories as articular and non-articular. Here you can see the articular parts and the other parts are non-articular. So first we will talk about the articular part. In the anterior view, here you can see the capitulum, and this part is known as trochlea. So this capitulum joins with the head of the radius, and it is situated laterally, and this shape is hemispherical, and this is not visible on posterior view. So when we talk about the trochlea, it is attached with the trochlear notch of ulna, and this is situated medially, and trochlea is pulley shaped. And you can see here the medial edge projects down more than the lateral edge. Remember that here the medial edge projects more than the lateral edge. So the articular part of lower end is consists with two parts as capitulum and trochlea. Capitulum is joined with the head of radius and it is situated laterally, and its shape is hemispherical, and it cannot be seen from the posterior view. And the other part is trochlea. It joins with the trochlear notch of ulna. It's situated medially and pulley shaped, and you can see here the medial edge projects down more than the lateral edge. So that's all about the articular part. Now we are going to talk about the non-articular part. Non-articular part is consists with fossae and epicondyle. There are two epicondyles as lateral epicondyle and medial epicondyle. Here you can see the lateral epicondyle, and this is medial epicondyle. And this lateral epicondyle gives attachment to posterior compartment muscles of forearm. And the medial epicondyle gives attachment for the anterior compartment muscles of forearm. And there are three fossae as radial, coronoid and Olecranon. Here the radial and coronoid fossae can be seen from the anterior view, and the Olecranon fossa can be seen from the posterior view. Here you can see the radial fossa. This is coronoid fossa, and this is Olecranon fossa. And this radial fossa is immediately superior to the capitulum, and the coronoid fossa is immediately superior to the trochlea. This accommodates head of radius when flexed, and this accommodates coronoid process of ulna when flexed. And this Olecranon fossa is the largest one, and it is immediately superior to the trochlea from the posterior view, and this accommodates Olecranon process of ulna when extended. So that's all about the lower end of humerus, and I'll give a brief idea again. There are two parts as non-articular and articular. Here the articular part is consists with capitulum and trochlea. And when we talk about the non-articular part, there are fossae and epicondyle. There are two epicondyles as lateral and medial. It attaches with the muscles of forearm, and there are three fossae as radial, coronoid and Olecranon. So this radial fossa get accommodates head of radius when flexed, and coronoid fossa get accommodates coronoid process of ulna when flexed, and this Olecranon fossa get accommodates Olecranon process of ulna when extended, and this is the largest one. That's all about the lower end of humerus. So if you like these videos, Please hit the like button and don't forget to subscribe my channel. So thank you guys.